शाम को पूजा करके रात में एक टाइम खाना खा के मैं सो जाऊँगी. एंड सोऊंगी तो क्या, सॉरी, आई हैव टू गो बैक टू द ICU फॉर माई नाइट ड्यूटी. Hey guys, welcome back to another vlog. In this vlog, I'm going to show another week as an ICU doctor during my PG first year. What we typically do in ICU duties, the kind of cases we handle, and yeah, so just jump into the vlog. Alright guys, so I just got back from my second night duty in the ICU, and usually we get back late because after our night duty we also hand over the duties and give rounds, virtual rounds to our seniors. And as of now we have 4 patients. The first one being a patient of type 2 diabetes mellitus with hypertension and chronic kidney disease with secondary hyperparathyroidism, severe mitral regurgitation, grade 2 left ventricular dysfunction, severe anemia, possible ascites, and bilateral pleural effusion, and all those diagnoses belong to just one patient. Coming over to the next one is rather simple. She came in with loose stools and hypovolemia. Coming to the next case, it's rather simple. She came in with acute gastroenteritis and hypovolemia with severe dehydration and moderate anemia with hypokalemia. Bed number, whatever, the next bed has acute exacerbation of COPD with lower respiratory tract infection and type 2 respiratory failure with right heart failure with tinea incognito and pus discharge from the groin, hypertension and ischemic hepatitis with acute kidney injury with hyperkalemia and ARDS. And the last one has type 2 diabetes mellitus, came in with hypoglycemia, but she also has hypertriglyceridemia and hypothyroidism and a low ejection fraction of 25 to 30%, ICMP, CRS, diabetic retinopathy, diabetic foot ulcer, and WES complex on gallbladder. Alright guys, तो मैंने एक short nap ले लिया and सुबह I showed you that I had a milkshake and one lassi I believe, or 2 milkshakes, I'm not sure. फिर लंच में मैंने जाके पी लिया मैंगो शेक, और ये क्योंकि आज मैं फ़ास्ट कर रही हूँ तो आज सिर्फ मैं शेक पीऊँगी दिन में, शेक, चाय एट्सेट्रा. और रात में मैं एक टाइम खाना खा के शाम को पूजा करके रात में एक टाइम खाना खा के मैं सो जाऊँगी. एंड सोऊंगी तो क्या, सॉरी, आई हैव टू गो बैक टू द ICU फॉर माई नाइट ड्यूटी. So I just thought I'll give you an update because I rested after coming back from duty, and now I will just probably use my phone, take some more rest, and prepare for the evening. By the way guys, I often make myself lassi with the dahi that I get in the hostel. It keeps me hydrated as well as energetic. In the ICU, we often get to learn different new things from our seniors. इस बार ICU में मैंने ABG रिवाइज़ किया. उसमें रोम कैटेगरी एंड मॉडिफाइड विंटर्स फार्मूला कैसे अप्लाई करना है, ये सब हम डिस्कस कर रहे थे. उसके बाद मुझे लैपटॉप भी लेके जाना पड़ा क्योंकि साइड बाय साइड मुझे प्रोटोकॉल का भी काम करना था. इस वीडियो के एंड में मैं आपको बताऊंगी कि थीसिस प्रोटोकॉल कैसे बनाया जाता है एंड हाउ यू कैन सबमिट इट. Alright guys, so I thought I'll just let you know about how we manage a patient when suddenly his BP rose to more than 200 to 100. So he was already on antihypertensives because he was a known case of hypertension, and he was also receiving regular dose of Lasix 40 mg. So what we resorted to do when his BP suddenly rose to 203 upon 116, two or three readings repeatedly like that, we decided to start him on nitroglycerin, NTG. So first infusion dose of NTG that we started was 0.1 ml bolus, followed by infusion of 1.2 ml per hour, but that had to be adjusted according to his next following readings, and it went up to 1.8 ml per hour And as you know, nitroglycerin NTG when started has to be tapered before stopping. So we had to take his BP reading every 15 minutes until we could taper the NTG off, and he didn't get tapered until the morning round. So the entire night someone had to keep taking his BP manually so that we can taper his NTG safely. After tapering his NTG safely, we also put him on his regular antihypertensive, which is Telvas, Telma, and so after that, we made sure that the BP didn't shoot up suddenly, because this is a common side effect after stopping NTG, that the BP suddenly shoots up. So we keep him on some antihypertensive prophylactically before completely weaning off the NTG. मुझे कुछ प्रिंट आउट्स चाहिए थे, एंड मुझे सबने कहा कि लाइब्रेरी से प्रिंट आउट्स निकाल सकते हैं. इसी बहाने मैंने लाइब्रेरी की ट्रिप मार ली, एंड इट वाज अमेजिंग. Okay guys, so I just got back from the library. I had gone to my college's library for the first time today, and I should go there more often. As soon as I get over with my ICU duties, I'm going to go to the library, and right now I just have to sort a few papers and tidy up the room, and then I'm good to go for tonight's ICU duty. Guys, I just got my drink ready. I basically drink collagen as often as I can, maybe once a day or 3 to 4 times in a week, and I don't know what to do about the tanning. It's so evident on my face and on my hands, and I just cleaned the cupboard. So I have given my clothes for laundry wash. They take around 700 for unlimited number of clothes per month, and that was a huge pile. And right now I've just set my cupboard and put my winter clothes away. I'm going to take out my summer clothes. Going to have to buy a few new shirts maybe, because I don't have much professional summer clothes yet. Alright guys, so yesterday was so busy that I literally couldn't vlog anything. That's because I had to do some final editing on my thesis protocol, and also I had night duty. So basically night duty, then working on the laptop during the day, and then again night duty. It was all back to back at a stretch, and I didn't get to record anything. But today was relatively calmer, and right now I was napping after getting through with the protocol submission and everything, and right now I'm just resting and preparing for the next thing, that is tonight's last ICU night. I'm waiting for my face mask to dry. I'll share a few things that I learned this week in the ICU. So whenever we increase the FiO2, for example, if we switch from 1 liter to 2 liter by nasal prong, 2 liters per minute, then the concentration of oxygen, the FiO2 increases by 4. For example, if we take room air to be 20 to 21% oxygen, then at 2 liters per minute means 28%. So for every 1 liter per minute, there is an increase in 4% oxygen concentration. This is one thing. And also, when a person is in SIMV mode, when we are trying to extubate someone, first we will switch from IPPV, that is intermittent positive pressure ventilation, to SIMV. And during that case, we do not sedate the patient, because the whole point of switching from IPPV to SIMV is to taper the patient's sedation and gradually extubate him. So we do not use vecuronium or midas for sedation when a patient is intubated and is on SIMV mode. So these are two interesting things that I learned during this week's ICU duty. So for my last ICU night, I had to keep the crash cart ready because a patient was suffering from shortness of breath and she had severe kyphosis due to which the lungs were dysplastic. After the long night at the ICU, I had to run down to Kolkata for some urgent work, and it was a good breather. It was great to catch up with my family and friends after so long. It's almost unimaginable during residency. So guys, I thought I'll give you a quick glimpse of thesis protocol. So thesis submit करने से पहले in first year you have to submit the thesis protocol, which is basically like an abstract. So thesis protocol ये एक sample protocol है. इसके basis में I will edit my own thesis. So my thesis topic has to do with 2 different doses of one drug, comparative study of the effect of that drug when taken in 2 different doses. Basically we have to say which dose is the best, and उसके लिए there are certain things that we have to do first. For example, if I give you a rundown of my thesis, then the first page will be like this with the logo and name of your professor and everyone. That differs from college to college. Each college have their own protocol which you can get hold of from your seniors, and then उसके बाद we'll come directly to the page where we'll attach the certificate from the institution. So this is an approved thesis, and इसके order के basis पे I will also put my protocol in order. So starting with the pro forma for registration and then certificate from institution, then there'll be the declaration page, declaration by the candidate, certificate by the head of the department, endorsement by dean of the college, undertaking, certificate from institutional ethical committee. After that, the main crux of the protocol will start, wherein you will put the introduction. Then comes the review of literature, where we'll discuss certain points about the articles that we have reviewed to make this article. So then we'll move over to the aim and objective, then methodology, and after aims and objectives we have to do the inclusion exclusion criteria, and then we'll do the methodology. After methodology we will have to write this conflict of interest and source of funding nil if that's the case, and then we'll come over to the sample size calculation, then we'll come over to the statistical analysis. For this we had to talk to the statisticians to get the sample size ready based on our thesis topic. Then we'll come to the pro forma for data collection, where we'll insert tables for the main research, whatever we are going to keep a tab of for our thesis. For example, if I'm comparing 2 different drug doses, then I have to note down the side effects with the different doses and the time of onset of sensory and motor anesthesia and the duration for which they lasted. So all that will go into the tables which we'll attach in the pro forma, and after that we will come over to the informed consent. So the consent that we give to the patient. Then the same thing in Hindi. Then confidentiality statement for investigators. Then undertaking from the investigator, patient information sheet, and references. So this is the basic format of the protocol to the thesis that we have to submit. This is just a sample blueprint. According to this, we will have to make ours. This is basically the format that has been shared by the university, and we have to make our own protocol in this format. Okay guys, so with that I'll end this vlog. I hope you liked it, and if you liked my video, do like, share, like, share and subscribe. And I'm going to come up with more productive videos about my residency life, especially if you're interested in anesthesia and critical care. This channel is really going to be helpful.